Hello, I'm Dr. Jonathan Mermin, Director of the National Center for HIV/AIDS, Viral Hepatitis, STD and TB Prevention at the Centers for Disease Control and Prevention. I want to share information with you about the unique needs of one population at increased risk for sexually transmitted diseases, or STDs, gay and bisexual men. Over the past decade, young men who have sex with men, or MSM, and especially young MSM of color, experienced increases in HIV diagnoses. MSM also made up the majority of reported syphilis cases in 2014, and half of these men were also infected with HIV. And over the last few years, CDC has received reports from 20 states of more than 200 cases of ocular syphilis, some of which caused blindness. Most cases were among MSM living with HIV. There has also been an increase of gonorrhea in gay and bisexual men, in an environment where we are down to our last effective treatment option, a single dose of 250 milligrams IM of ceftriaxone and a single dose of 1 gram of azithromycin orally. But there is also good news. STDs are highly preventable. During STD Awareness Month, we highlighted 3 things we can do all year long to help prevent STDs. Talk, test, and treat. Talk about sex. Talking about sex with patients can be challenging, but the good news is that studies show that patients want to be asked about sex. We can create an environment open to an honest discussion around patients' sexual history, partners, and practices. Knowing our patients' risks can improve our ability to prevent and treat STDs. We can talk to our patients about safer sex and ensure they know about today's many disease prevention options, with condoms, hepatitis B and human papillomavirus vaccines, and pre-exposure prophylaxis, a daily medication to prevent HIV infection. There have never been more ways to protect against these diseases. Test. CDC recommends screening sexually active gay and bisexual men at least once a year for HIV, syphilis, chlamydia, and gonorrhea. Those with multiple or anonymous partners should be tested more often. Follow-up testing for syphilis due to repeat infections is important to do, as well as rectal and throat screenings depending on the type of reported sexual history. Finally, treat. CDC's STD treatment guidelines offer solid information to protect the health of our patients and stop the spread of STDs in this population. We can address the testing and treatment needs of sex partners too, by testing them and at the same time prevent reinfection. Those of you on the front lines of clinical care play a vital role in reducing the burden of HIV and other STDs and ensuring the health of gay and bisexual men and every patient. Please join me today and every day to talk, test, and treat our way to better health. Thank you.